My name is Dr. Norman Ramirez, and I'm a structural cardiologist. I do take care of structural heart problems. I'm with Rio Grande Valley Cardiology, and I've been practicing here in the Rio Grande Valley for the last 32 years now. I grew up in the Valley, and I went away to the best colleges and schools and medical schools and training that I could find. That included going to Yale University, Stanford University, Duke University, and I was on staff at Mayo Clinic for several years before I came back to the Valley. The reasons I came back is because I wanted to introduce new and state-of-the-art treatments for cardiac problems here in the Valley. And since coming back, I've introduced numerous things that weren't here before, including the first implantable defibrillator cardiac implant here in 1989. I put some of the first cardiac stents in here. I did some of the first carotid stents here. And I've enjoyed bringing all those things to the Valley. Lately, over the last 5 to 6 years, I've been doing primarily structural heart. So I've done the first TAVR here in the Valley, the first Watchman implant here in the Valley, the first MitraClip implant here in the Valley. Those are all treatments for conditions that are life-threatening, and patients used to have to travel outside of the Valley, often to Houston or San Antonio at the closest, to be able to get these kind of procedures done. It's very difficult for patients to do that. So I've introduced all those things here in the Valley, and it's been very gratifying for me to be able to do those procedures here. So I treat a wide range of cardiac conditions, and I've been doing this, as I said, for the last 32 years here in the Valley, and for 40 years being a doctor now. I take care of all kinds of heart problems. I mean, I still do coronary stents. I take care of patients that have coronary artery disease, that have arrhythmias, that need pacemakers or implantable defibrillators. But over the last several years, I've moved more toward taking care of structural heart problems, such as severely leaking heart valves or severely blocked heart valves, for patients that are prone to have clots in their heart that can break off and cause strokes, those kind of things that previously required open heart surgery to fix, and now I'm able to take care of those without having to do open heart surgery, just by going percutaneously through the arteries in the leg usually, and able to do them and save patients from having open heart procedures completely. So what can patients expect from me and my staff? First of all, again, that we're trying to do procedures that are life-saving, that previously required open heart procedures. So we're trying to avoid putting a patient through a long, difficult hospital stay, try to get them in, get the patient treated, and get them home as soon as possible. I'm doing almost exclusively these kind of things, so I'm not overloaded with patients. I've been very busy for the last 40 years, but now I have plenty of time to talk to our patients. My staff is aware of this. We take all the time that they need to meet with us. These are difficult procedures, and we want to explain them fully to the patients before they go through them. We want to explain all the risks and benefits, and we'll take all the time that they need for us to go through them so they understand fully what we're doing. We're going to do our best to take care of them. That's what I've tried to do for the last 40 years, and we will do our very best to take care of them, and we want them to fully understand what we're doing and to leave with a happy experience and happy and feeling better than when they came into the hospital.